Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Tanjuatco-Trillo. Today on the program, amid fears of a new COVID-19 variant, authorities expand the travel ban to other countries. Regulators are now investigating the controversial vaccination of the president's security detail after the presidential security group chief confirmed the unregistered vaccines administered to his men were donated. And experts warn of an artificial downward trend as health authorities report lower daily cases of COVID-19. What preparations are in place in case of a possible surge next year? Health Secretary Francisco Duque joins us live. The Philippines further tightens travel restrictions over fears of the new coronavirus variant. President Duterte approved the expansion of the current travel ban to include other countries apart from the United Kingdom that have reported cases of the new, more transmissible variant. Take a look at your screens right now. As you can see, we are flashing the list of those countries right now. Flights from the UK, where the variant was discovered, have been banned since earlier this month. The expanded ban is in effect until January 15th, 2021. Now let's go straight to the source of this story. Health Secretary Francisco Duque III joins us this morning. Sir, thank you for being here.
Good morning, Ria. Good morning to all your viewers, and thank you for giving us the opportunity to share with you important issues of the day.
Sir, I want to begin with talking about the travel ban. That definitely is an important issue. The president has approved it. What's the next step here? Is this list going to be updated in real time in case there are other countries that discover the new variant on their shores?
Yeah, well, it's a dynamic list. Once there are countries that report the UK variant, then we will definitely expand the list.
Okay, sir. Now, so far, I believe OFWs are exempted from this ban. Tama po ba?
Yes, OFWs and returning overseas Filipinos.
Okay. Of course, I guess they are discouraged from coming home. But if ever they do, what are the arrangements for them to come home if flights are canceled and so on?
Could you say that again? I'm sorry, I didn't get it.
Oh, okay. So for OFWs who do want to come home during the period of the travel ban, are there arrangements for them to be able to do that, or will they just have to wait till after January 15th?
Well, if they're coming home, the president has reiterated time and again that they will have to be subjected to a strict 14-day quarantine. So it's really up to them if they want to come home and go through the quarantine period. Or they want to postpone their trip coming back to the Philippines until after January 15.
Would the government be making any special arrangements for them to come home if ever flights are canceled?
Well, we'll have to discuss that with the DOLE, the DOTR, the OWA, because I'm sure there will be some requests for them to be brought back. If there are no commercial flights owing to a very small volume of passengers.
Secretary, there is another new variant of COVID-19. Apart from the UK one, there's this one now from South Africa, which is said to be slightly different. What do we know about this particular variant?
Well, we still don't know much about it, save for what you know. That it is also so far identified as a South African variant. And it will take about 7 days for us to even identify through genomic sequencing the UK variant if indeed it has reached our shores.
Okay, so no information on that yet. But sir, still on the topic of the travel ban, of course, you came out with the news the other day, and then this was followed also by an announcement from Secretary Bello. But then later in the day, Secretary Roque actually refuted what you both said, saying that at that point there had been no actual decision made on that. How do you resolve issues of miscommunication like this among secretaries? Because, netizens are expressing their criticisms and questioning kung talagang nag-uusap ba kayo yung mga members ng IATF.
Yeah, nag-uusap kami. At in fact, we were one in that recommendation which the president approved. Remember that the recommendation to ban temporarily travelers except for OFWs and ROFs. This recommendation was approved by the president, and we were there. I think that was Monday evening when the president approved it. Now, I must admit that the guidelines didn't get issued early enough. So yun lang yun. But the same order has been issued later in the afternoon. So a little kink, so to speak.
Secretary, regarding this new variant, as of the moment and to the best of your knowledge, is the Philippines still free of the UK variant of COVID-19?
Yes, I can say that there is no evidence to show that this UK variant has already reached the Philippines.
All right, but is this a question of if it will reach here or more a question of when it will get here?
Well, you're right. It's not a question of if, it's a question of when. Notwithstanding the fact that we can also have our own variant here, that could happen in the Philippines. So we just have to watch out for this. But at the end of the day, the one major intervention is always compliance and adherence to the minimum public health standards. So whatever is the variant, no, I think what is important is for our people to understand that we are not defenseless. Hindi po parang wala tayong laban. May laban po tayo rito at nakita naman po natin. Pagkatapos ng 10 buwan, nakita na po natin yung ginagawa natin at ako po nagpapasalamat sa ating mga kababayan. Nasunod po sila, lumalaki po ang porsyento ng ating mga kababayan na nag-face mask, face shield, physical distancing. Although of course, ngayon holidays, no? Yung umiikot ako, medyo maraming talagang mga tao na nakakakalimot ang halaga ng physical distancing. Pero ganun pa man, nakita naman natin na we have been able to bring down, stabilize the number of new cases between 1,000, 1,500. And hopefully this will go down to a 3-digit number of cases. No? So yesterday we were about 750 plus. And so I hope that this will continue. But let me just caution you about these numbers because it is during this holiday season, people are less likely to have themselves tested. No?
That's right.
So we will only find this out maybe towards the end of the first week of January, what the real numbers look like.
All right. So yes, it is encouraging to see those 3-digit numbers, as you said, but by no means should we be relaxing. And when we spoke to Professor Guido David the other day, he said the same thing, no? That over the holidays, the days around Christmas, testing capacity was maybe at the 50% of what it usually is. But sir, were you satisfied with the safety protocols during the holidays, the way they were followed and enforced?
Yes, by and large, what we have been doing, and you've seen the DOH visibility all this time, no? From the start of the holiday season, and we've been going around visiting together with local chief executives, visiting public markets, malls, transport stations, etc., nonstop, no? And so far, we've seen good results, but still. A lot has to be done in terms of more effective enforcement, no, to make sure people are distanced adequately or sufficiently.
Sir, you said we'll see the possible effects of holiday gatherings maybe in the middle of next month. What are we expecting those numbers to look like?
Well, it's hard to, I think it's premature to say how those numbers will look like. But hopefully, it's not going to increase. And if it does, it's going to be manageable, not to reach the threshold of overwhelming the health system's capacity.
So you're saying, sir, kahit magkaroon ng surge, post-holiday surge, all our healthcare facilities will be prepared and will be able to deal with such a surge?
Yes, that is correct. As we have continued ramping up our capacity, both from the supply side, which means the quarantine facilities, isolation facilities, the hospitals, the efficient referral patient navigation system. So the point is we should be able to bring the patients depending on their clinical manifestation or symptoms, to the appropriate healthcare facility. So we don't want the mild asymptomatic going to the hospitals. They have to be referred back to the lower level isolation and quarantine facilities so as not to crowd out those patients who might actually be having severe to critical clinical manifestations that really warrant more thorough hospital care.
All right. And one last question, Secretary, before we go to a break. The government's goal is for the entire country to be under MGCQ by the first quarter of next year. Is that a reachable goal?
Well, you see, the president has already approved the status quo, keeping most of the NCR to the GCQ risk classification. So that's up to from January 1 to the 31st of 2021. Now, after that, we are guided by our sub-tactical working group on data analytics. And they're the ones with the Epidemiology Bureau of the DOH and the COVID Surveillance Quick Action Unit who put together the data and analyze such that they will make the recommendation whether we will de-escalate. If the numbers warrant to de-escalate, then we will do that. If we continue to bring down the number of cases based on the attack rate and the 2-week growth rate and the critical care utilization rate of our facilities, then if the indication to de-escalate to the modified general community quarantine, which is the least restrictive of all community quarantines, then we will do that. However, if there's a sign of a surge, a continuing increase in the number of cases, then we will not hesitate to recommend to the president to escalate to a higher community quarantine.
Right, so a lot of it is really just wait and see. Secretary, please stay right where you are. We still have lots to talk about. Regulators are still at a loss on who's accountable for the controversial vaccination program for the Presidential Security Group. Secretary Duque tells us more after the break. This is The Source on CNN Philippines. Stay with us. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, welcome back. Now, I want to start talking about the PSG vaccination. So many questions surrounding this right now. General Durante said these vaccinations took place in September and October. Did you know anything about this then?
No, I wasn't told about it.
So you only found out, sir, when the president announced it?
Exactly.
All right. Now, the DOH was not consulted, but you are investigating exactly what happened. Could you update us on the investigation and what exactly are you looking for?
Well, you're right, but I would like to defer to the regulatory agency, FDA, under the DG, Dr. Eric Domingo, to conduct a full investigation of these alleged donated vaccines that were used for the purportedly the PSG was the group that was given these donated vaccines. So it will have to investigate who imported this, who distributed it, who administered it, how was it brought to the country. The Bureau of Customs, I think, will also help form a composite team that will investigate the issues surrounding these alleged vaccines given to the PSG.
This morning, Secretary Lorenzana said that the PSG vaccination was illegal, although he also doesn't know exactly where the vaccines came from. Now, in all of this, it seems that the FDA was really bypassed. Did you feel offended by this, especially since the vaccine protocols that you worked very hard to put in place were basically disregarded?
Well, Ria, as I have said earlier, I want to defer to the FDA. So I would not want to be personal about it. I just want to be guided by whatever pieces of evidence are presented to me soon after the investigation has been concluded.
Understandably, the public really wants officials to be held to account here. Now, they're calling this a donation. If indeed it was a donation, Secretary, would the donor be held liable, or the people who administered the vaccine, would they be liable as well?
Well, that's going to be part of the investigation. We'll have to get those facts out as soon as possible, and then only can we have some more defined conclusions to make. But as of the moment, I don't want to speculate.
So is there a timeline, though, for the ongoing investigation?
Well, I can ask. What I know is that after the holidays, I think the results will be out or will be concluded. So it depends on what initial findings will be gathered by the FDA regulatory enforcement units working in tandem, presumably with the Bureau of Customs.
Speaking of the Bureau of Customs, sir, on their part, they've said that there were no documents of the unregistered vaccines. So this, of course, would then lead to assumptions that these vaccines were smuggled. So if officials are using smuggled vaccines, what message does this send out to the general public?
Well, as I've said, I would have to defer to the results of the investigation, and I would not want to be drawn into speculation.
Right, sir. Now, regarding the vaccine, has the president himself asked you if he could be vaccinated himself? Of course, he is in a high-risk category, being in his 70s and with several health issues.
What I only know is that the president has mentioned that his doctor does not recommend that he be vaccinated until the vaccines are actually made to go through stringent regulatory technical evaluation and be cleared for its safety and efficacy or effectiveness.
All right, so the president will not be getting the vaccine just yet. Sir, for your part, what steps will you be taking to, again, prevent the possible smuggling of unregistered vaccines to the Philippines?
Can you say that again, Ria? I'm sorry, I didn't get it.
Sure, sir. On your part, what steps will you be taking to prevent another incidence of the smuggling of unregistered vaccines into the country?
Oh, well, we have to abide by the laws of the land. FDA law is very clear. This has to be followed. We should not violate this. If that happens, the risks might be too much to take because you do not know. You have no idea as to the safety of such vaccines. So it's best that they go through the process of scientific evaluation, regulatory and technical evaluation by agencies such as the Department of Science and Technology and also the Vaccine Expert Panel and the Single Joint Ethics Review Board prior to the list of approved candidate vaccines to the FDA for further regulatory and technical evaluation, and after which the FDA makes an assessment of the risk versus the benefits. No? Then will the FDA issue the emergency use authorization, as was ordered by the president through an executive order.
All right. Well, of course, those laws and guidelines were in place before this incident. But again, Secretary, please stay with us. We have lots to talk about. How is the government preparing for the new year amid the threat of a pandemic? Secretary Duque will still be with us after the break. You're watching The Source on CNN Philippines. You're watching The Source on CNN Philippines, and our guest today, Health Secretary Francisco Duque. Good morning once again, Secretary. I want to keep to the topic of the PSG vaccinations as we start this portion of the show. Yesterday, there was a nurses group that really lamented the vaccination of members of the PSG because obviously nurses are part of the frontline health workers, and they are on the top of the prioritization list. What is your message to them, sir, after all of this?
Oh, they will continue to form part of the list of priority groups. So they shouldn't worry. We have to make sure that the vaccines are safe and efficacious or effective. And we are prepared if should there be some minor side effects, we will be able to help manage those side effects. And that's what we're doing. And we're not new to giving vaccines. No? The DOH has been doing its task of immunizing or inoculating our people for several decades. No? So we know how to deal with this. But first things first, it must go through the process to assure safety and effectiveness. And of course, practicability of implementation.
On the basis of science, Secretary, who is most at risk? Would it be a frontline medical worker or would it be a soldier?
Well, the most at risk would be both. In fact, that's why they are within the priority list that we have put together. But of course, the frontline healthcare workers are relatively more at risk because they directly care for patients with COVID. So, if only for that reason, they should be the number one in a short list of priority groups.
All right, sir. Now, according to the ILG Secretary Año, he said at least one cabinet member has been vaccinated. Would you like to make an appeal, sir, to other government officials regarding unregistered vaccines?
Yeah, I'd like to appeal that they shouldn't allow themselves to be inoculated with vaccines that have not been proven as to its safety and efficacy. So remember, this is a new vaccine, okay, because the virus is novel. And also there are platforms that are novel, meaning the first time that they're going to use such a platform, like the mRNA that is being used by Moderna and Pfizer. So we have to be doubly careful about the vaccines that will be used to immunize people against COVID-19.
All right, sir. Maiba naman ang usapan. I want to talk about the PhilHealth contribution hike. What is your reaction to this contribution hike? And is there any possibility that it could be put on hold?
Well, that has to be addressed by the board of PhilHealth. I am not sure if this has been sent. Any correspondence or request or appeal has been sent to PhilHealth. But I will ask soon after this interview.
All right. Thank you for that, sir. And what is your message to the public, given that, again, understandably, there is a level of a distrust due to the controversies that continue to hound the agency?
Can you say that again? I'm sorry.
Yes, sir. What is your message to the public, given that there is some mistrust due to the controversies that are hounding PhilHealth?
Oh, yes. Of course, the new president and CEO, former NBI Director Attorney Dante Geran, is on top of the reforms that are being undertaken by management. And let's give him sufficient time to prove his mettle and his success in instituting those much needed reforms in three fundamental areas in terms of fraud detection, deterrence, and prevention, and in terms of sufficient public education as to how they can exercise their benefit rights. It's not, hindi kasi tama yung pagka lang may sakit, tsaka mo lang malalaman kung ano yung mga benefit rights mo. Dapat, even before you get sick, alam mo na ano yung mga iyong mga rights, no, in terms of the benefits as provided for by the PhilHealth law.
All right, so there is a need to also educate the PhilHealth contributors, no, sir?
Yes, they need to be told that under the universal healthcare law, the program or the scheduled minimal increases in the contribution rate is needed to ensure the long-term actuarial sustainability of the system.
That's right, sir. Now, quickly, we just have a minute to go. I need to ask you about the new year. How is the DOH preparing for New Year's festivities, sir?
Oh yeah, like every year, you know, we make sure that the hospitals, the emergency services are ready to accept these cases, emergency cases. So that's why tomorrow I'd like to invite the CNN representative to join me as I make my rounds of hospitals to make an assessment of their emergency preparedness, no? As I have been doing for the last 4 years. And so this is something that is very important for the DOH to undertake, and also keep reminding the public as to the deleterious effects, the injuries that can be had if there is a careless reckless use of whatever fireworks. By the way, Ria, as far as the DOH is concerned, there's no such a thing as a legal fireworks. No?
That's right.
Everything is injurious. So we do not buy, that position that, well, there are fireworks that are not rendered illegal, and therefore the message is you can use it. No, you cannot use it.
Right.
Because,
so whatever you buy, it's illegal.
Yeah, even a very small, innocuous fireworks can lead to serious injury and tetanus. Okay, tetanus is a life-threatening complication of fireworks injuries. No, so we tell people, itigil po natin ang paputok. Let's use alternative noise and merrymaking. The tambol, the kalan, busina,
wag din yung turotot. Bawal ngayon yung turotot, di ba, Secretary?
Bawal ang turotot. Bawal ang turotot. Kasi yung turotot, kakanyunin mo kung meron kang COVID. Alam naman natin, after 10 months, no, meron talaga mga asymptomatic. Andun sa kanilang lalamunan at sa may ilong, yung COVID. At kapag tumurotot ka, laway mo, malayo aabutin yan. Alam naman natin, ang mode of transmission is via respiratory droplet.
All right. Sir, I'm afraid that is all we have time for today. But again, we thank you so much for giving us time here on The Source. And thank you for joining us here on The Source. I'm Tanjuatco-Trillo. You're watching CNN Philippines.